Thank you everyone for coming today to the official launch of Hamilton's plan for an age-friendly city. I am Monica Quillen. I am the president of the board of directors for the Hamilton Council on Aging, and I will be your MC for this afternoon. The Hamilton plan for an age-friendly city was approved by the Hamilton City Council on September 24th, 2014. This age-friendly plan aligns with and builds on the good work that is already underway in our community. We would like to extend a very special thank you to over the 700 older adults and other key stakeholders that contributed to the development of the plan, including the following members of the project steering committee that guided and advised as the plan was developed. And I would ask that if members of the project steering committee are here today, that you stand as your name is called. Mark Weingartner from Neighborhood and Community Initiatives, Community Services Department, City of Hamilton. Denise O'Connor, Hamilton Council on Aging. Margaret Denton, Hamilton Council on Aging. Jean Mayo, Seniors Advisory Committee. Beatrice McDonough, Chronic Disease Prevention, Public Health Services, City of Hamilton. Susan Goodman, Hamilton Council on Aging. Monica Quinlan, Hamilton Council on Aging. Penelope Petrie, Seniors Advisory Committee. Amanda Grenier, Gil Brea Center for the Studies of Aging, McMaster University. Denise Doyle, YWCA Hamilton. Don Jaffrey, Hamilton Social Planning and Research Council. Eleanor Morton, Recreation Division, Community Services Department, City of Hamilton, right on time, good timing. Angela Dorr, United Way of Wellington and Greater Hamilton. Evelyn Myrie, Hamilton Center for Civic Inclusion. Susan Barberstock, Hamilton Regional Indian Center. Bianca Pisani, Centre de Santé Communautaire, Hamilton, Niagara. Maxine Carter, Access and Equity, Corporate Services, City of Hamilton. The Hamilton Council on Aging is proud to be collaborating with the Neighborhood and Community Initiatives Division with the City of Hamilton and the Seniors Advisory Committee on Hamilton's plan for an age-friendly city. I would like to welcome Ron Smithson, Chair of the Seniors Advisory Committee, to say a few words. And after Ron, I would like to invite Margaret Denton, the Vice President of Hamilton Council on Aging and the Chair of the Plan for an Age-Friendly Hamilton Committee. Ron?
It's been a pleasure working on this project for the last session of council with this group, and it's finally coming to a conclusion. Although it still has other work to do, because once you have you have to get the details that go inside it. The Seniors Advisory Committee is a committee that reports directly to the Emergency Community Service Committee of the City of Hamilton, which is made up of about 8 city councilors. And we then break up into 4 groups, which one of them is age-friendly city, and the other is transportation, seniors recreation, and housing. So all those committees, we have subcommittees at work, so we're trying to get an all age-friendly city. And And so it's been a pleasure working with this group, and some of the members of have been on this committee for a while, and I know that you're going to enjoy what's going to be here. And I thank you for following and inviting me.
Before Margaret comes to the microphone, I would like to acknowledge the attendance of one of our members of parliament for Hamilton Centre, Chris Christopherson, who is sitting at the back. I'm changing people's name too. Thank you for taking the time to be here with us this afternoon. We appreciate it. We know it's constituency week, so I'm sure your agenda is quite busy, so thank you for being here. Margaret?
We're really thrilled that we have such a large turnout today to hear about our plan. We're going to make a presentation in sort of 3 parts. I'm going to begin by just setting the context. And some of you have heard this before, but maybe some of you haven't. So I'm going to tell you all about the World Health Organization's initiative around planning for an age-friendly city. And then we're going to hear from Denise O'Connor, who is our consultant at the Hamilton Council on Aging. And she worked very hard in terms of developing the plan and doing the community consultation that led to the plan. And she worked with Mark Weingartner from the city of Hamilton. And so Mark is going to be the third presenter, and Mark is going to tell us specifically about what's in the plan and what our next steps are. Volunteer board of directors and of 12 of us. And a program staff. You've all met. We have one program staff. You've all met Sheila Kiley, who does so much work putting these presentations together and organizing us all. And one of our strategic areas has been to move forward with respect to an age-friendly Hamilton. So part of this initiative has come because, as you know, the oldest members of the baby boom generation is actually turned 65 in 2011. And our population, it's aging, and people are living longer and they're living healthier lives. And we need to start planning for this, our aging population. So there's actually been a global trend from people, in the past, that most older people lived in rural areas. But as we moved into the 20th century, people have moved to urban areas. So many of our older adult population are living in urban centers, and we need to start, planning for this change in the demographics from the urban to the rural, from the rural to the urban. Sorry, and the social and physical environment affects everyone. So we need, when we do our planning, we need to sort of make sure that our physical environment will accommodate the needs of people as they grow older and perhaps need to have a few more mobility problems, for example. And we need to make sure that our social environment accommodates our aging population so that people have meaningful activities that they can engage in and that they're able to access those meaningful activities. So in Hamilton, you can see that by this graphic that the aging of the population, so we actually have about 28% of the Hamilton population is over the age of 55. And it's around 15% that are 65 and older. And this is going to increase, so that by the year 2031, we're going to have almost a third of our population age 55 and over in Hamilton. So the World Health Organization back in 2002 became concerned about the aging population, and their response to it was to actually develop an initiative around creating age-friendly cities and communities that would help to accommodate our aging population. So what is an age-friendly city? Well, an age-friendly city establishes policies and programs and services and infrastructure that support the physical and the social environments, and so that it's designed to enable older people to live in safety, enjoyment, good health, and well-being, while continuing to participate in society in a meaningful way. And why this initiative really attracted me was because so often in the newspapers, etc., you see, all of these headlines, all about the concerns of an aging population and silver tsunamis and, all these horrible things that are going to happen because our population is aging. But in fact, I like to think of it as, as an opportunity, right? This is an opportunity, and it's actually, it's really an accomplishment of our times that people are living as long as they do. And so instead of blaming the individual all the time because we're getting older, this approach sort of says, no, we need to take a look at our physical and our social environment and to design it in such a way that people can live, in safety and enjoyment and have opportunities to participate. So it's a positive focus. It looks at what we can do. So there are actually 4 steps to an age-friendly city, and the first one is in planning. So what you need to do is to take a look at, what are the needs of the community? What are the barriers and the opportunities to creating an age-friendly community? What is our need in Hamilton? What do we need to do to make Hamilton a more age-friendly city? And then once you sort of establish what that need is you actually develop a plan to address that need and to make your community more age-friendly. And once you have that plan in place, and so this is kind of where we're at now, we have the plan in place. So once you have that plan in place, you implement that plan, and that usually takes 3 or 4 years to implement all the recommendations in the plan. And you evaluate as you go along to see, okay, what's worked, what hasn't worked, what do we need to do next. And then you sort of engage in continual improvement. So you're just always moving closer and closer to becoming an age-friendly city. So how did we get involved in Hamilton? Well, so we started thinking, and we heard about the age-friendly initiative in 2007, and so we thought this is the direction that we would like to go in with the Hamilton Council on Aging. So we actually applied for an Ontario Trillium Foundation grant, and we received one in 2008. And so at that time, we used what was called the Vancouver Protocol to assess what the need was in Hamilton in terms of becoming age-friendly. And we did 15 focus groups. We talked to about 130 older adults. And we came up with 92 recommendations to make Hamilton age-friendly. And we produced this report, Hamilton, a City for All Ages, that a number of you have probably seen. And it was endorsed by the City Council in 2009. So, but then we thought, well, okay, how do we actually move this forward? And we thought, well, this isn't something just that the Hamilton Council on Aging can kind of do on its own. We really need to engage the community and important stakeholders in our community to help us move forward in terms of making Hamilton age-friendly. So we formed our first steering committee, a small steering committee, that included the United Way and the SBRC and the Seniors Advisory Council and the city. And we started to talk about, well, what do we have to do to create a plan for the city of Hamilton with respect to making things age-friendly? So what we did with our second grant was, we plotted and planned and tried to figure out how to move this forward, but we also took a look at what has actually been accomplished in the city of Hamilton already in terms of making things age-friendly. Who was working on what? What were the areas of opportunity? What were some of the challenges? And we came up with our second report on Hamilton, a City for All Ages, 3 years on. So, as I said, we thought that there was, that there is a need for a plan, that we needed to get the sort of partners working together, the City of Hamilton, the Seniors Advisory Committee, to create this plan that we could move forward with. And why we thought it was really important in Hamilton that it be a community plan, so that there were recommendations that addressed the City of Hamilton, as well as recommendations that address the agencies, the organizations, the businesses, etc., that serve older adults in Hamilton. So what the plan is, it's an effective local policy approach, really, for responding to demographic aging. And it ensures the needs of seniors and older adults are considered when developing policies and delivering services. So the idea that, for example, if we're working ahead on in terms of transportation in the city of Hamilton, that people put on a senior-friendly lens to the transportation plans, for example. So that's just one example. So the other point I wanted to make here was that even though we're planning for older adults, an age-friendly city is really fantastic for everyone of all ages. It meets the needs of people of all ages, from small children, mothers pushing buggies, to people with mobility limitations, to older adults. So we moved ahead with, in terms of developing our plan, we broadened our steering committee, and we now becomes a Hamilton's Plan for an Age-Friendly City steering committee. And again, I chaired it, and you can see that we broadened the number of organizations who were sitting around the table helping us develop the plan. Okay, and I'm going to leave it there and invite Denise to come and continue on with the presentation.
About seniors when we talk about older adults, and there's a reason for that. So there's some people who are very attached to the notion of seniors, and typically people who are quite a bit older and wear this badge of honor. There's a real issue with that baby boomers, and Margaret and I would be in that category. I'm sure many of you in this room are in that category. Not really identifying, we're not really accepting the fact that we're moving into that category. You know, I'm actually quite annoyed about it. So in order for us, and we don't see ourselves, what we found when we were doing consultations over the last couple of years is that people in this demographic, the 55 to 65, they're talking about older people. Like, they mean seniors. We don't see ourselves, and that our needs are also need to be considered in this plan, because we actually are the gray tsunami here. As much as we don't like that term, it's us, right? And certainly the needs of seniors now need to be addressed, but there's the bulge of the aging population isn't people who are 80, it's people who are in their 50s and 60s. And so we're trying to soften that and start to have us all think of ourselves in the relative terms in the process of aging. So that's why you'll see seniors. When we talk about seniors, we talk about people who are 65 and up, according to all those other definitions, but that's what we're using. But we talk about older adult more generally for that reason that I just described. Okay. So in terms of the, Margaret mentioned, we know what the needs are. We've been hearing what the needs are for a long time. I mean, the research is out there. People have what they need. The question is, how do you get there? And as Margaret mentioned, the idea was to essentially need a plan, right? Unless you know unless you have a roadmap, how do you know where you're going? But because there's so much research that's been done, research by the Council on Aging, but also research all over the world with the World Health Organization, the expertise we have in this community from the university, from the social service agencies, but also from obviously older people themselves to talk about their lived experience. And so what we did, rather than just go and ask them again, what do you need, we looked at specific documents. So the 2010, that works, the 2010 report, the 2013 report, to see what we're doing, because there'd be nothing worse than coming up with a plan and people are saying, well, we already do that. So, and of course we found that too sometimes. There's a lot of assumptions that things aren't available by people who are in the community, and then when actually you go to look, you find out it is available, you just don't know. Or conversely, as I look at my friend Mary Sinclair, there's things that are supposed to be available that we find out are not available. So that 2013 report on where we're at, what's working, was really about starting to engage with the community and private sector really on what's available and what's not available. And so that was the purpose of doing that report, is to delve down into the systems piece as much as the needs piece. Seniors Advisory Committee, I'd like to say, right here. I've been doing work for years, as Ron mentioned. Their subcommittees work has been very deep and broad in areas, and they were a great asset to us. It was great having them as a partner. And there are recommendations that are in the report that we just took directly from the work that we've done. Again, our whole kind of thinking on this was, firstly, we had a fairly quick timeline, but also why reinvent the wheel? Why do something that people are already doing, and why burden people with being asked again and again and again the same questions? So that was another piece of what we did. We looked at the age-friendly work from the WHO. A big source for us was age-friendly plans from across Canada, because what we know is that people all want the same thing, and there's certain things that are common across communities and ways of doing things that we can learn from other communities. So we actually borrowed quite heavily from Edmonton, Ottawa, and Mississauga in particular, but we looked at many other plans. And so some things we just lifted when we knew what the issue was, lifted a great idea directly from somebody else, which why wouldn't you, right? City of Hamilton corporate policy frameworks. There's so much rich work that's being done in the city. The Housing and Homelessness Action Plan would be a key example of that. Housing is huge, and we know it's a very basic, very important piece of meeting people's needs. And so all the work that they did over the numbers of years, they developed that plan, rather than say, okay, let's do that again, be stupid. We just essentially took their plan as part of our plan, and asking that the seniors, the older adult plans be added to that. Similarly with the pedestrian master plan, pedestrian mobility master plan, I think it's called. Great, very progressive, complete street kinds of talk that older adults need as much as the young people who are asking for it. And so there were a lot of things already going on in the city that we built on. So that was a really important piece, I think. Finally, what we heard from you. So a lot of you in this room, I think we're at one or more of the meeting. In fact, I know many of you were at a number of the different meetings that we held. We held some very specific ones with people in systems. And we're bringing older adults into that conversation as well, so that they could have that more dynamic interaction in terms of finding creative solutions and finding out what people's challenges are. And also the groups that we did around the city. So we heard from you about what's working, what's not working, where the linkages are, because it's not a question of knowing what we want, it's how you get there, right? So it's the how piece, and what are the pieces in the system. The city is such a complex organism, and many of you you all do great work, but many of you are doing things that other people in the system don't know about, because there's no system, right? It's a bunch of people working in tandem, or working sometimes connected and sometimes not. And that's not to cast any blame on anybody. It's simply the fact of life when you have a city as large as Hamilton. Okay. So in terms of what we were going to look at, we know that what we look really is at what people share. Most people want the same things. They have differences in what their experiences are and what they need, and that can vary geographically as much as any reason, as anything. And so we talk to people who live in rural Flamborough, and they have a very different experience than people who live in downtown Hamilton. We talked about transportation. People who live downtown love the HSR. For them, it was a lifesaver. People who live in rural Flamborough, they don't have bus service. So in terms of their mobility issues, they're very different. And so people want to be connected, they want their basic and their higher order needs met, but they all have a different experience of transportation, for example, depending upon where they live, but also maybe whether they speak English or not. So if they can't understand the fare structure, or even a bus route, because that information is not available to them in any language but English, therein lies the challenge. So essentially what we looked at, what our focus is on systemic and environmental factors. So Margaret talked about physical and social, same kind of thing. So there's the physical infrastructure and geography, buildings, is it evident, where the automatic door opening button is? In some buildings we found that not to be, it isn't evident at all. And social factors, how are people received or treated? There's a whole actually piece on customer service, essentially, or listening and understanding that people want to be treated as responsible adults, full adults, not as children when they're older. There's a whole bunch of things there too that we pulled into this report. So, so there was a process that started in 2013 when we actually framed what is it we're going to look at. So we did a number of focus groups that first in 2013 in the summer to help us frame how we would do the next phase. And then as you can see here, focus groups held consultations. The typical thing that you should do, as many different media as we could find, and individual discussions as well. So here's just sort of an overview of what we did, as I mentioned. We also engaged city staff, and that was a really important piece, because what we did was we after we had a draft of the plan, it was really important, and we didn't just engage city staff, but also other stakeholders in the community, that we go back to the community and say, this is what we're thinking in terms of a recommendation. Does this make sense? Have we got it right? Is it doable? Or is it just plain totally off base? And so I remember sitting down with Sheila and Mark and I, with Eleanor Morton and with Denise Doyle one time to talk about the recreation pieces, because it's complex, and we didn't want to just make an assumption that we understood, how things work in that sector in a way that would make the best possible recommendations. So as much as we could, or where we felt that we were maybe on shaky ground, this is how we approached it. And what we did do that I was particularly, I think was quite important, actually. I'll get to that in a minute. So these are just, again, the details. We also reached out to ethnocultural communities. We did that through HCoA, but also through Hamilton Council on Aging, and Mark also did some consultations, I think, with a couple of ethnocultural groups as well, to make sure that that we heard from those perspectives. And because we weren't making recommendations specific to this group and that group and that group. It's more generic at this level. We couldn't include everybody. We had, let's say, limited resources. And so essentially, we looked at what the common issues are for people from various groups. My slides got changed a little bit. Okay, so the one thing I was going to say about engaging the city, when we had a draft of the plan, we actually did a 3 or 4 hour session, I think, where we invited, because Mark had interviewed 48, not sure, some number of public servants across the corporation, the city of Hamilton, to find out what their internal issues were, but also how they saw from their experience, what was lacking and what was working, and essentially really getting into accessing the knowledge of people who work in the field, which is one of our big goals, to access to all the wisdom of people like you in this room, to see what they identified as the key issues. And what we did then was, when we had a draft of the plan, we invited them to a 3 hour session in which we did breakout groups and worked through the aspects of the plan, so that they could actually say, okay, this makes sense. This is great. You've missed the boat on this one. This is really, this one's awesome, this one is, and it was really important because it gave them a say in the plan before it went to council, because they're the ones that are going to be asked to implement it, and it has to be something that makes sense to them and that they have a stake in, and that's the only way you ever get any change. One other thing I'd like to mention too is that one of the fun things about this was that there were times when we would engage with the community, and people would have conversations who may not normally be in a room together. So you'll have someone like Darts in the library, or somebody in the same conversation, and something new comes out of it. So people were starting to implement change immediately when they learn something. I think, oh, I never thought of that, or we could do that this way now. And it doesn't require a plan. It's not a big deal in terms of like a systems change, but sometimes small changes make a really big difference. And having those conversations start to change things before you even have your plan. And I think that's the magic of the processes that we used, in which you engage a broad sector of people from different communities, different sectors, in conversation where there's this space to reflect, that you get to that point where you have creativity happening and change on the ground, changes of attitude even, understanding of what others do, and all those things are really important to building the relationships that you need in order to move forward with any kind of change. I'd like to mention too that at that city meeting, Chris Murray, the city manager, stayed for the whole 3 hours. We thought he was going to come in and make the introduction and introduce everybody to lead. He stayed, and Paul Johnson stayed, who we expect to see here shortly too. So it was really important in terms of leadership from the city to have them in that room and have them stay for that whole time. So in terms of the next step from that, well, we did the writing, and then we did that piece, and then we just went refine, refine, refine. So it took us a couple months to get through that, but it was a pleasure working with all these people, Jean Mayo, being with Donna, Mark Weingarten, Sheila, Margaret. It was very productive, and I have to say the challenge was always a positive challenge. It was always a really good, productive kind of way of working together. Okay, so this is my last slide. This idea, we created overarching goals, and Mark is going to present those to you, and objectives under those goals. And the overarching goal is broad enough that we don't see that this plan as being the be-all and end-all. You know, we expect that under those goals that people will start to say, well, this is what we can do, or this is an objective that we could adopt in order to meet that broader overarching goal. And these are actions we can take. So we don't see it as a finished document. We see it as a really good document that as things change and new opportunities emerge, that people will continue to see it as a living document. And we're really hoping that that's how it works. And so this implementation stage that we're undertaking next is really crucial to really keeping people engaged and moving forward as a community on this. And that's my piece. I'd like just to acknowledge that Aidan Johnson, our new councillor from Ward 1, came into the room.